Hi, Shanda. Just wanted to do a quick sound check with you if you wanna unmute.
Good Lord, you'd think I'd figure out like what being on mute does. I wouldn't have to
That's okay.
say, get
No,
off
you
mute.
sound great. Sound great. Looks great. Looks good. So, any questions before we get going?
No, but in case you say my name Chanda, like panda.
Yes, I have to keep telling. I really want to do that long A or that short.
I
A,
know.
whatever.
Lots
Anyway.
of people want it to have an R too, so Chandra. So
Oh, really?
I just say
Okay.
act like you're from the South and have a little bit of attitude, and you cannot mispronounce it. Like Chanda Chacon. Like a little bit of sass, Brian.
Attitude's the key. All right. Awesome. All right. We'll get going in a few. I'll probably just do some housekeeping with the media, and then Jeremy will kick us off, and he will introduce you one by one, and then we'll do a little bit of a panel discussion after that. So
great. Sounds good.
Thank you. See you soon. Hi, Bill. Thanks for joining us. Can we do a quick sound check with you and video check?
Absolutely. Can you hear me?
You're good. Good quality and looks good. So, any questions
Awesome.
for me before we get going?
No, not at all. I've got the agenda for today's meeting, so I think I'm all set.
Okay. All right. We'll see it. We'll start in just a few. Thanks, Bill.
Okay, I'll leave my video on. I'll just mute myself.
Okay. Thanks.
Thanks.
Jeremy, do you want to do a quick sound check?
Yeah. Can you hear me, Brian? Check, check.
Yeah, that's
All
good.
right.
All right. Thanks.
We'll get started here in just a couple minutes. Thank you, Bill and Chanda, for joining us.
Absolutely.
You're welcome.
Just waiting on our next, our last presenter to join us. He's should be hopping on here in just a minute, and then we'll get started. In the meantime, if any of the media has would like recording access, please go ahead and message Brian Noonan with the Hospital Association in the chat box, and he will give you access to be able to record. We are also recording, and we'll send out the link after the call. Let's hop on here. All right, Brett, can you do a quick mic check?
Yep, can you hear me?
Great. All right. We're all
Sorry.
good. Thanks. No problem. All right. Thank you, everyone, for joining us today in our series of Zoom press conferences here with our hospital leaders from around the state. We started these back in early January to make sure the media and, quite frankly, the public at large was hearing directly from our hospital leaders about what's going on inside our hospitals across Nebraska. And we every week try to bring you 3 leaders from a diverse perspective between urban, rural, larger systems, smaller hospitals, and to make sure you can communicate that out to the public. During this press call, if you have any questions, please put them in the chat. We'll answer those as we get them at the end of the call. I am Jeremy Nordquist, president of the Nebraska Hospital Association, and again, very thankful that you're all here to participate in this. In the weeks ahead, we really hope to be talking about turning the corner from COVID, certainly from this surge, but we're certainly not there yet. Hospitalizations in Nebraska still remain at a very high level. They've plateaued for the last couple of weeks between 700 and 750 hospitalizations due to COVID. That's a near record level outside of a very short window last fall. We're also seeing positivity rates for COVID remain at a high level. They have come down a little bit in the last week, but still around 20% positivity rate in the last week, which is a very high level for the duration of this pandemic. So we want to make sure the public understands that our hospitals are grappling with those challenges, even though there might be a notion out there that things are getting better and we're turning the corner. Our hospitals are going to be working very hard over the months ahead to care for those individuals who come in with COVID, and then also try to build back in those procedures that Nebraskans are desperately waiting for. And that's going to take some time as well. And we really hope the public understands that, continues to be cautious and continues to be patient with our hospitals as they work through this very challenging time. Obviously, we continue to want to encourage Nebraskans to get vaccinated. Statewide, we're at about 73% who have at least taken the step to get one vaccine, a shot, but we certainly need Nebraskans who are eligible to get the booster. We know that prevents hospitalizations at a very high level, 40, 46, 49 times less likely to be hospitalized with the booster than if you're unvaccinated. But even with 73% statewide starting the vaccine process, we don't see that uniformly throughout the state. We know we have some pockets of the state, certainly in western Nebraska, that remain, some counties are still in the teens, the high teens in terms of fully vaccinated residents. So we continue to encourage Nebraskans to talk to their medical providers about the evidence and to work through that with their healthcare professionals and make the right decision for themselves and their families and their community. Today, we have 3 great hospital leaders with us to talk about the unique challenges that their hospitals are facing. First, we have Chanda Chacon, President and CEO of Children's Hospital and Medical Center, Brett Richmond, President and CEO of Methodist Fremont, and Bill Calhoun, CEO of Kearney Regional Medical Center. So we'll go through in that order and ask them to tell us what's happening in their hospital, what their workforce is, the unique challenges with the patients they're serving, and then we'll take questions after that. Chanda, go right ahead.
Great. Thank you, Jeremy. I really appreciate being here today and to really offer up a lens into the pediatric perspective as we talk about the impact of COVID here in our state. So the first message from my perspective is we've been sharing this from children since the spring of 2020 that COVID does impact kids and continues to do so in really challenging ways. According to the Children's Hospital Association, since the beginning of the pandemic, more than 9 million children have been diagnosed with COVID. And in the past 10 days, 900,000 of those positives have been reported. And so we're seeing that increase. It's the largest number we've seen in a week and a really since the beginning of the pandemic. So in recent weeks here at home, we've also hit the highest number of pediatric inpatients with COVID here at Children's. And on Friday, we had 18 children who are positive. Today, we have 13 that are in our inpatient units. And we've seen those double digits of inpatients for the past about 8 to 10 weeks, which is about 4 times higher than we have seen at any other time during the pandemic. Very few of these children are on ventilators, and we haven't experienced any pediatric deaths that children's from COVID, but co-infections and other respiratory illnesses are really prevalent in these children. Every day, we also see about 2 or 3 children in our preoperative services that are diagnosed with COVID, and it really shows that there's a more asymptomatic infections happening in kids as well. Positive tests for the past 4 weeks that we've seen and the tests that we've given have ranged anywhere from 35% positivity rates up to 44, which is also the highest we have seen since the beginning of the pandemic for children, which normally it's been in the mid-teens as a percentage. So as you can imagine, this significantly impacts our work, our staffing, elective surgeries, patients we have seen. And as community members and as parents know, COVID-19 has really disrupted kids' lives in a way that has taken an impact on their social and emotional and mental health. And we've seen rises in the number of children and teens presenting with suicide attempts, depression, anxiety, and emerging data illustrates that COVID-19 pandemic has had a really significantly negative impact on the mental health for children. So prior to COVID-19, 1 in 5 children experienced a mental health condition, and today suggests that number is about 1 in 4. And according to the Children's Hospital Association as well, from April 2019 to October of 2020, Children's Hospital have seen a 24% increase in the number of mental health emergency room visits for kids ages 5 to 11. And for teens ages 12 to 17, there's a 31% increase. In the first half of 2021 alone, Children's Hospitals reported cases of self-injury and suicide for children ages 5 to 17 at a 45% higher rate than last year. So the need for our specialized pediatric services continues to be great across the state and region. And this is where I want to pivot just a tiny bit briefly to talk about our team. So to me, the reason we've been able to do this is because we have an amazing group of people, and we really strive to put people first in our culture here at Children's, because we know that people power the mission here. They're our superpower and really our heart and soul of what we can experience here. And so I really want to publicly recognize their commitment and their courage during this time. They keep showing up to serve, not just in basic ways, but in really being excellent. And that's what our community deserves, getting excellent outcomes and experiences during this challenging time. So I'm honored to be a part of the children's team and want everyone listening to know what an exceptional children's hospital we have here in Nebraska. And it's really because of our strong and highly skilled people. So I look forward to sharing more in the conversation. I have, as you can imagine, lots of information if people have questions. So thanks, Jeremy. I appreciate the time.
Thank you, Chanda. Thank you for being here. Brett, please go right ahead.
Yeah, thank you. And Chanda, we are really fortunate to have Children's in our state. So thank you. Similar message. Again, thank you for taking time to participate and listen to our stories today. Like Chanda, I'd like to first give out a real shout out to our, roughly 1,000 local Methodist Fremont Health team members for their heroic efforts over the last almost 2 years now. So, we're a medium-sized hospital, kind of located just outside the Omaha market. So in some ways, our experience kind of closely mirrors those in the metro area. And in some ways, it sometimes mirrors some of the rural hospitals in our state. So we have, on the average, typically we have an average acute average daily census in the mid-20s. We also have a behavioral health unit, but our acute census is typically in the mid-20s. And for us, as a mid-sized hospital, we're used to a variation in our census, and we're able to kind of flex up and flex down to meet that census. And historically for us, those volume fluctuations last a few days, maybe a couple weeks, occasionally a month, maybe a month and a half. But for us here locally, our volumes have been somewhere between 30 and 50% above normal now for the last more than 4 months. And that variation, those additional patients are almost exclusively driven by COVID positive patients. So that's put a real strain on our organization. And it's a combination of both the volume of patients and the intensity of those patients. Locally, we have an 8-bed ICU, and we typically would have maybe 3 or 4 patients in the ICU. We've been kind of at, near, and sometimes above our ICU capacity over the last 4 months. And so if you're a hospital our size, and I'm sure, the other CEOs may share a similar story, the only way you handle that volume is by asking your team members to work additional. So, the classic example is a lot of nurses work 312s. What we've had to ask them to do is to work 412s and sometimes 512s to kind of match that volume. And obviously that kind of wears on people over the course of several weeks and now several months. A little bit about our kind of experience from a vaccination standpoint. So in Dodge County is about 40,000 people. About 2/3 of our adult population, so 18 and older, are vaccinated. The 2/3 of that population actually only accounts for about 1/3 of our admissions kind of since the Delta and Omicron wave. So going back to, say, September. And typically what we see from those who are vaccinated and still need to be admitted is they're usually in their early 70s on the average, and they do really well. They're here for a few days for treatment and they go home, and again, they do relatively well. The 1/3 of our population that's not vaccinated has accounted for about 2/3 of our admissions. And those patients look a lot different. They're typically on the average in their early 50s. They're here for a number of days, if not sometimes weeks. They're oftentimes in the ICU. They're oftentimes on ventilators. So, from our perspective, the vaccination really works. Chandra hit on a little bit about behavioral health. We also have an inpatient behavioral health unit here. We've got a 20-bed unit. We've seen since the beginning of the pandemic, so if you compare our recent volumes for calendar year 2021, and you go back to 2019, so before the pandemic, our volumes are up about 50% in our inpatient unit. Now, part of that's been our ability to kind of staff and grow that program. We're still a relatively new program. We've been around about 5 years now, but a lot of that really is from the demand. So we too are seeing kind of the impact of COVID, not just on people's physical health, but their mental health as well.
Thank you, Brett. Bill, tell us what's happening out in your area.
Thank you, Jeremy, and thank you for Chandra and Brett for their highlights of what's going on in their neck of the woods. I service as the CEO of Kearney Regional Medical Center, which is in central Nebraska, and we have outreach locations in 20 locations across central western Nebraska as well as northern Kansas. And as a rural regional medical center, small rural regional medical center, we're servicing not only those outreach locations, but also patients who come to us either directly through our emergency department or directly through our clinic services here in town. Buffalo County is roughly 50,000 people, and our catchment area in total has about 200,000 people. And what I would like to accentuate is we use a barometer of nursing vacancy and turnover to make a determination if we have the staffing to appropriately address the needs in our hospital. And NHA just recently did a study, and we know that over the course of the next few years, we're going to run a shortage of 5,500 nurses. We know that nearly 75% of our counties have lower than the national average ratio of registered nurses, and 60% of the counties in the state are deemed to be medically underserved. Being in central Nebraska and in the rural part of this state, we are really feeling the pains of the understaffing, as well as the constraints on physical capacity in our hospital. We're a small hospital. We have approximately 56 of our beds are designated specifically to intensive care, progressive care, and medical needs. And it's oftentimes we've been running at 30 to 40% of that capacity that has been COVID-related diagnosis. And in addition to that, much like Brett's organization, our ICU is 10 beds. And we've not only dealt with staffing constraints, but also physical constraints of not having enough beds available to COVID patients that are coming into our hospital. In addition to the physical constraints and the staffing constraints in the hospital itself, we've also had to go so far as to putting trailers on our campus. We have a respiratory therapy trailer for treating clinic patients who come to us with respiratory symptoms. We have 2 infusion trailers. So for those people that are diagnosed with COVID, if we can treat them outside the hospital setting and prevent more significant symptoms from happening and keep them out of the hospital, we certainly do that, with the hopes that we can return them home with or without home care or some other setting. The other challenges we're faced with is not only are we dealing with a nursing shortage, we're also dealing with other key clinical specialties like respiratory therapy. And we're competing not only amongst ourselves in Nebraska, but across the nation, paying extreme amounts of pay for traveling nurses. So we've lost nurses to retirement because of the challenges with COVID. We've lost nurses who have chosen other professions, and we've also lost many of our nurses, respiratory therapists, and other clinical people who have taken 3 and even 4 times compensation changes and have entered into contract relationships with other organizations to not only contract with hospitals in the state, but other hospitals in the country. So it's a real dilemma. And we just don't have the supply of nurses and other critical clinical people to fill the vacancies that we have in the state, let alone low single-digit unemployment rates. In a county like Buffalo County, we've got less than a 1% unemployment rate. And so we depend on local service workers to assist us with our phlebotomy positions, our nursing positions, our nursing assistant positions at the bedside. And we're just having a challenge finding those folks to fill our vacancies. So as a result of that, it's not unusual for this hospital to be on diversion. So diversion to us means we can still take patients who might show up in the emergency department, but they might have to sit in a hallway and be cared for in a hallway versus in an ICU bed. Because unfortunately, our neighbors to the east in Lincoln or Omaha are facing the same dilemmas we're facing. We don't have a place oftentimes to transfer these patients. We do accept patients through our clinic, but there are those occasions when outreach organizations will reach out to us and say, are you able to take a patient? One last story that I'll share with you just to give you a sense as to the plight of some of the outreach locations. I got a call from a CEO just a handful of weeks ago, and his hospital, a critical access hospital, not far from Kearney, they had attempted to reach out to 5 states and 70 hospital facilities to transfer a COVID patient who was in their hospital. And we made accommodations here at Kearney Regional Medical Center. And the way we were able to do that is in order to free up a bed, we needed to exchange patients. So we sent a patient from Kearney Regional Medical Center to this critical access hospital in order to relieve them of the acute care need of that patient who is in dire need from that facility to bring them to our rural regional medical center. So it certainly is a challenge for us as well. We appreciate our neighbors in Lincoln and as well as Omaha when they are able to provide some tertiary relief, but we know that we're all constrained.
Thank you, Bill, and the stories that you share and the situations that Brett and Chanda have gone over as well are not unique to your institutions, but we're certainly hearing them from all of our member hospitals. A majority of our regional referral centers, the larger hospitals in Omaha and Lincoln and like Bill's that take referrals from critical access hospitals, a majority of them are operating north of 90% capacity of staffed beds. And that means you're really stretching the workforce you have. And many of their capacities are down due to that limited staffing. We are thankful, as we talked about briefly last week, and the governor last week formally rolled out the investment by the state in trying to open up some skilled nursing beds, because that has been a problem for our systems, our hospitals across the state, trying to move patients to the appropriate level of care. And just today we have, tomorrow, we should have our first skilled nursing beds open up in Lincoln, followed by Omaha and Grand Island. And we think it'll be a good step to relieve a little bit of that pressure. But again, we're still at that really peak levels of hospitalizations. And even as we try to decompress and we come off those peaks, as I said earlier, we're not turning the corner yet, because our hospitals and their staff are going to be doing a lot of work to try to continue to care for very high levels of COVID patients. And and reinstate procedures that have been delayed that Nebraskans need for their care. With that, we'll go to some questions here, and our panelists can kind of feel free to jump in as they see fit. First one, I wanted to ask if you guys are seeing evidence that the Omicron wave has peaked, such as lower case numbers, fewer people seeking treatments in the ER, and fewer people being admitted to the hospitals. I'll also throw in this next question, which is CHI health officials last week suggested latest models show that the state may be at or near its peak in COVID cases. Do you see that in your hospitals? Brett, do you want to go first?
Yeah, I'll take that. So, I think one of the things we probably all learned is to be really careful about predicting anything over the last couple of years. But I think we all follow the state data and the public health data really closely. And there does appear to be some evidence that cases maybe have peaked in Nebraska in the last, handful of days or week at the most. Typically, what we see is hospitalizations, the peak of the hospitalizations lag cases by a week or two. So, I don't know that we, from a hospital perspective, have really, I think we're yet to see the impact of what we hope has been a peak of cases throughout the state. So we'll keep our fingers crossed, but I would anticipate we're prepared for those numbers to continue to go up from a hospital perspective over the next couple of weeks. And I think that trend, Bill may want to comment. I think, the peaking, our state's very different as you move from east to west as well. And so I think we all know the population, most of the population is in the eastern part of the state. And so I think it probably has peaked in the eastern part of the state, but that may not be true for central and western Nebraska.
The only thing I would add to what Brett was sharing, we were on diversion in our ICU progressive care unit as well as med surg unit last week. Toward the tail end of the week, we were able to lift our diversion status in med surg as well as PCU. And then today's counts would suggest that we're no longer on diversion for all three of those units. And we're watching our respiratory clinic volume, and that has dropped by approximately 20 to 30%. So that data here for Kearney Regional, being a regional center, would suggest that we're seeing a reduction in the number of Omicron cases.
I would add from just a pediatric perspective that for us, this is our normally very high time for respiratory virus season for kids. And so we're not really looking at the reduction of COVID cases. We're just looking at staying strong and just predicting that COVID is going to be here to stay. And we need to be prepared for other spikes in volume, but really be prepared for respiratory viral season as well, as we're seeing that increase. So I think it's sort of just a constant struggle that we're going to have in healthcare of really being focused on how we manage volume and how we stay prepared for COVID as it goes for the longer term.
That's right. And to Brett's point too, about not knowing the future, Dr. Donahue from the state last week was going into a little detail around it was the B2 sublineage of Omicron, which in some countries have shown kind of stopped the peak from falling quite as fast as it would have otherwise. So we do have a little bit of that now in Douglas County, and are keeping an eye on that. And we don't know what potential that holds for spread and hospitalizations in the future. Bill, we have a question specifically about what have the mental health struggles been like in Kearney Regional?
If you're talking specifically about the staff, staff have been tired, fatigued, both emotionally as well as physically. We've tried to strike a balance by offering opportunities for folks to get out and enjoy life outside of work. We face the same pressures in terms of the sheer numbers of hours that we're asking people to work. We've increased the amount of traveling nurses who have come into our facility to offer a needed relief to our nurses, and that seems to be, or has been, received quite well. As far as the doctors seem to be holding together quite well here at the organization. And then in terms of having access to behavioral health resources in the community, we've got a really nice network of mental health providers in the community to help support the patients who are needing care in the local communities.
We already addressed kind of the expected hospitalization changes ahead. A question is the extra cost of patient transferring recently going to drive up cost to patients? I don't know if this is specifically about SNF and if anyone wants to address that in terms of transfers from cause to your facilities, but in terms of the state program that transferring to those facilities, that is going to be completely state funded with federal dollars. I believe it's leftover CARES Act funding that has not been spent yet by the state. So they're making a multi-million-dollar investment in staffing up to 98 skilled nursing beds to help with hospital decompression. So that will be completely funded out of those funds in terms of costs associated with that. Do you have any other questions from the media? If not, one more popped up here. Are you seeing improvements in the delays involved with transferring patients to larger hospitals? How long is it typically taking to find a hospital to take a patient, and what does that look like as opposed to recently? Brett or Bill, if you want to talk about transfers in and out of your facilities at all and kind of what that looks like right now.
Yeah, obviously we're part of the larger Nebraska Methodist Health System. So it's a hard question to answer simply because every day's a little bit different than the day before. Things change almost hour by hour. And so, we may have some success in transferring a patient today and not be able to do so tomorrow. So if it's been better, it's been slightly better the last few days, but I think that still kind of remains to be seen. I think, and Bill would probably agree with this, when you're smaller, you have more variation around your averages. And so it's, you got to be really careful about getting too excited about the day when your volumes appear to be down, because the next day you could be in the opposite situation. So again, I think at least here locally, we're hopeful that will get better in the coming days and weeks. But I don't know that we've seen enough to say that that's happening yet.
Here in Kearney, we've faced the same challenges that Brett and his folks have faced over in that side of the state. It is difficult to transfer patients out from here for acute needs, whether it be to Lincoln or Omaha. We are now part of a larger health system, which affords us a little bit more opportunity, perhaps from a day-to-day perspective. But I will tell you that our most significant challenge right now is someone who needs placement outside of the acute care environment. So finding a placement in a nursing home is nearly next to impossible. Most of the nursing homes that are in our area are just simply not taking transfers of patients. And our other acute care providers, like the critical care hospitals, have indicated that they're willing to accept admissions into their swing bed facilities. However, that too is challenging based on not only the acuity of patient, but also payment problems, because oftentimes some of these third-party payer sources are not willing to compensate for the care that a patient might receive if they're transferred from a facility of our size into a smaller facility. But of course, the work that you're doing, Jeremy, at a state level with the Department of Health and the governor will offer up just a little bit of relief in certain parts of the state from a skilled nursing perspective.
And Jeremy, I might add that, we're fortunate here. We also have a 106-bed long-term care skilled nursing facility that's part of our organization. We've got an 18-bed skilled unit there. So we've been a little bit fortunate, to have that. And when it's part of your organization, you're able to make some decisions from a global organizational perspective, versus a hospital versus a nursing home. It's all one organization here. So that has helped. But I'll also say, the nursing homes in our state, including ourselves, are faced with some really serious challenges as well. All of the staffing challenges that we've talked about, I think nursing homes throughout the state are suffering from just as bad, if not worse. And so that's a challenge as well.
Absolutely. And we've talked, did a press conference a couple of weeks ago about the work we're doing in the legislature to try to retain our current nursing workforce, recruit others in and build a pipeline for the future. But also just last week, the Hospital Association went to the Appropriations Committee in the legislature to talk about provider rates in the Medicaid program and Medicare. Also just talk about Medicare provider rates. Typically, the legislature doesn't adjust Medicaid provider rates in a non-budget year during a biennial budget, but we're certainly at a point where our hospitals are really struggling and are going to struggle to keep staff and keep up with staff, especially when so much of our revenue is dictated by Medicare and Medicaid. And those increases are 2%, 2.5% a year. And some of the hospitals we're talking to are looking at 15, 16%, up to 20% salary increases for sometimes across their entire workforce, or at least certain sectors of their workforce. So that's a top priority for us as we talk about advocating to the legislature when they, as they sit on additional revenue and look at how to make those investments. We've got to be able to make sure our hospitals have the resources to maintain their staffs and keep them in our healthcare workforce. So. With that, happy if any media has any follow-up afterwards, we're always happy to connect you to our hospital leaders across the state. So please feel free to reach out to the Hospital Association. And we plan to continue this at least another 2 weeks. And again, hopefully we will be turning the corner at some point in the future and can talk about that when that time comes. But as always, feel free to reach out. Thank you.
Thank you, everyone.
Thank you.
Thank you.